Hi, my name is Jinky Young and I'm going to perform the eye assessment. The first thing I'm going to do is to review the patient's previous medical record if available. So I'm going to check for any background information that the patient has for the previous eye assessment. Then I'm going to determine the scope of examination needed. So for today's scope examination is for the eyes. So this is for me to save time and energy. And then prepare all the necessary equipment I need to have. So I have here my pen light to be able to see my patient's eyes clearly. I also have here my surgical gloves or working gloves to prevent any spread of infection to my hands. I also have here my ruler to measure my patient's eyes clearly. And I also have here a opaque card to cover my patient's eyes. So make sure that all your equipments are complete prior to performing the procedure to save time and energy. Now I'm going to perform hand washing. It's important to proper wash your hands to make sure that your hands are clean and to prevent the spread of infection to your client. Then I also have here my gloves. So I'm going to wear gloves if necessary if there are any discharges, lesions, or abrasions on the patient's eye. Now I'm going to start on the introductory phase. The first thing I'm going to do is to greet my client politely, then introduce myself, verify my client's identity, and also to ask on how she would like to be called during the interview to establish rapport and trust between me and my patient. Also for me to confirm that this is the right patient I'm going to assess for the eye. Hello, good morning. My name is Jinky Young and I am your student nurse for today. I am from Davao Doctors College. Can you state your name?
I'm Juliet.
Hi, Ma'am Juliet. How would you like to be called during this interview?
Joy na lang po.
Okay, that's nice, Ma'am Joy. Next, I'm going to explain the procedures on my client and how she would perform during the procedure. And I'm also going to provide the opportunity for my clients to ask or raise any concerns. So this is to make sure that my patient knows all the procedures that we're going to do and to clarify the patient's concerns and questions you would like to understand. So for today, Ma'am Joy, I'm going to do your eye assessment. So I'm just going to check your eyes for any unusual disorders and abnormalities. So prior to performing the procedure, I'm going to need your full attention. So what you're going to do is just cooperate with me to follow my instructions in every test that we're going to make, okay? So if you have any questions, clarifications, so don't feel free to ask me, okay? So do you have any questions?
Gaano katagal po?
So this would last for about less than 15 minutes, okay?
Opo.
Okay. Then ensure the client's privacy, comfort, and confidentiality. So this is to make sure that you're not invading your patient's privacy and also to make sure that your patient is at comfort while you're doing this procedure. And make sure that your environment here is not free from noise and any distraction. So for you to be able to properly execute the procedures between you and your patient. So Ma'am Joy, I'm just going to close the door, okay?
Okay po.
Okay. So Ma'am Joy, I would just like to ask if you have any eye problems.
Yes po.
So what are your eye problems? Are you farsighted or nearsighted?
Farsighted po.
Okay. So do you have any eye surgeries before?
No.
Okay. And then I'm going to start doing in the working phase. So first, I'm going to test for the visual acuity of the patient. Prior to performing this test, make sure that if there are any use of visual aids, make sure to ask your patient if she wears any contact lenses or eyeglasses, except for reading glasses because they tend to blur the vision of the patient. And then let them wear it during this test. So ma'am, do you wear any contact lenses or glasses with graded lens?
Yes po.
Okay, can you please put it on for this test? And for this test, I'm going to let the patient stand. Can you please stand up? Over here. So I'm going to make sure the distance between my patient and the Snellen chart is about 3 to 5 feet. Okay, so I'm just going to cover each eye being tested and going to let the patient read the Snellen chart from the top chart until the line that she cannot decipher the letters or the numbers. The rationale for this is to check how the patient can see the numbers or the symbols, letters clearly. Okay, so first I'm going to cover your right eye and then going to test your left eye. Can you please read it?
E F P T O Z L P E D P E C F D E D F C Z P P E L O P Z D.
Okay, so now I'm going to cover your left eye to assess your right eye.
E F P T O Z L P E D P E C F D E D F C Z P F E L O P Z D.
Okay, now please read with both of your eyes.
E F P T O Z L P E D P E C F D E D F C Z FELOPZD.
So I took 3 readings. First the left eye, the right eye, and then both of the eyes. And then if the patient cannot be able to read even the top line, which is 20/200, then I have to perform the selected vision test. So I'm just going to perform the counting of numbers. So ma'am, please tell me what number is this, okay? And identify it. Okay, so what number is this?
1,
Okay, how about this?
2,
How about this?
3.
Okay. Then next, I'm going to assess for the visual field test. So what I'm going to do is that the patient sits. Can you please sit here, ma'am? So make sure that the distance between me and my patient is 2 feet apart. Then what I'm going to do, ma'am, is to put my fingers on the lateral part of your ears. And I'm just going to wiggle my fingers and then move my hands slowly until you can be able to recognize my fingers moving, okay? Then tell me if my fingers are moving, okay?
Yes.
So this is to make sure and to assess the optic nerve of the patient. So, going to start.
Hindi ko makita, ma'am. Hindi po.
Okay, how about this?
Okay po, makita po.
How about this?
Hindi po.
I'm just going to repeat it in the upper and lower quadrants.
Hindi po.
Okay, so if a defective area is detected, then I have to do or repeat the same thing again over the defective area until the better vision. So I'm going to repeat it several times until the borderline of defective is detected.
Hindi ko po makita, ma'am.
I'm just going to repeat it on the left eye since the patient cannot see well on the patient's peripheral vision.
Hindi ko po makita, ma'am.
Okay, how about this? I'm going to repeat it on the right eye to see if there's the same defect.
Makita ko po.
Okay, so how about this?
Hindi po.
Okay. So next, I'm going to proceed to the visual inspection of the eyes. So I'm going to first inspect the eyes for symmetry and evenness. Okay. So the eyes are even and symmetric. Next, I'm going to assess for the eyebrows, hair distribution and alignment, and also for the skin quality and the movement of the eyebrows. So this is to detect if there are any loss of hair in the eyebrows and unequal movement. Okay, so next I'm going to proceed on checking for the eyelashes, hair growth distribution, and also for the direction of the curl to detect if the curl are inward or outward. Okay, then next I'm going to inspect for the eyelid to check if there are any blepharospasms, ptosis, ectropion, and tropion. So inspect for the skin infection if there are around. When you open your eyes, and then close your eyes, and then open your eyes. Then next I'm going to inspect if there are any swollen on the lacrimal gland and sac. Okay. Then I'm going to avert the eyelid to check if there are any the palpebral conjunctiva, if there are any lesions, and the texture, but also for the discoloration. Okay. So next I am going to inspect and carefully the iris and the pupil. This is to check if there are any mydriasis and any sequoia. Okay. So next I'm going to inspect the cornea and lens for opacity, texture, and clarity. So this is to check if there is any bulging around the cornea. Okay, so I'm just going to shine a light on the patient's eye to clearly see. Okay. Then next, I'm going to proceed on performing the direct and concentric pupillary response to light. So what I'm going to do is just going to darken the room partially. So I'm just going to turn off the light. Okay, so I'm going to stand on the side of the patient and then going to assess each eye. So just can you please look on the far wall? Okay. And then also I'm going to inspect the other eye. And I'm going to observe for the direct and consensual pupillary response to light. Okay, so we're just going to turn on the light. So for the direct pupillary response, so the illuminated eye must constrict and the non-illuminated eye must also constrict. So now I'm going to proceed on assessing the accommodation. So I'm going to inspect the pupil reaction to accommodation. So what I'm going to do is to put a pen in front of your nose. So what you're going to do is just look at the top of the pen, and then after look at the far wall behind the pen, and then back to the pen again, And I'm also going to move it slowly. Okay. So, when looking at the near objects, the pupil must constrict. When looking at the far object, the pupil must dilate. And when the object is moving toward the patient's eye, the pupil must converge, okay? So, next I'm going to do the Hirschberg test. So, for this test, what I'm going to do is to make sure that I am 2 feet apart from my patient. The rationale for this is to check for the cranial nerve number 3, which is the oculomotor nerve. So what I'm going to do is going to shine a light in front of the patient and observe for the reflection of the cornea and also for the direct and consensual response. Okay, so light falls symmetrically on both of the eyes. Next, I'm going to inspect for the gaze field test. So what I'm going to do is going to put this pen on the front of the patient. So the rationale for this is to check for the eye alignment and coordination. I'm just going to put the pen center, and then what you're going to do, ma'am, is just look at the pen, okay? And make sure that your head is still. So I'm going to move it on the 6th cardinal position. So make sure to follow it with your eyes. So you need to start here, and then here, and then here, and then here, and then here, here, and then back to the center in a clockwise position. So next, I am going to inspect for the convergence. So for the convergence, it is also to assess the cranial nerve number 3, which is the oculomotor nerve. So what I'm going to do is make sure the distance between me and my patient is 2 feet apart again, and then let the patient look at the pen. So just please look at the pen, stay still looking, while I'm going to move the pen towards the nose. Okay, so that is for the convergence test. Now that we're done with the test, I'm going to summarize all my findings to my patient so that my patient will know all of the abnormalities, if there is any unusual disorders. So ma'am, based on my test, so your eye seems to be normal, but for the visual field test, I noticed that your left eye seems to be not looking properly on the things on the peripheral side. And then also there is no lesions, there's no redness or any infection on your eye. So all your tests are normal. Your eyelashes are curled outward, which is normal, and you also have no redness, swelling, or discharges around your eyes. So that's good. And then you can also see from the far vision. So you have 20/20 vision, so your graded lens are okay. So what I'm going to do is to recommend to see an ophthalmologist. So this will to have a checkup on your left eye, okay? So ma'am, it is very important to go for an eye checkup for every 3 to 5 years, okay? So do you understand anything, ma'am, that I've said?
Yes, po.
Okay, so when will you going to have a checkup on your eyes?
3 to 5 years po.
Okay, and then I'm going to refer you to an ophthalmologist, okay?
Okay po.
Okay, ma'am, so that's all for today. Thank you for your cooperation and thank you for coming here today. Thank you and goodbye.
Goodbye po. Thank you po.
Okay, so now I'm going to wash my hands. Make sure to wash your hands to prevent the spread of any infection. Then after, I'm going to go to my desk in order for me to write on my patient's medical record on all the findings that I've taken note. So that's all for my eye assessment.